millions of people around the world are suffering or have suffered from certain types of lung infections. The crazy part is many without even knowing it. Sometimes the symptoms are obvious, but other times they can go undetected. In this video we're going to talk about some of the signs that indicate that you may have already been infected without even realizing it. Be sure to hang around until the end, because there's one that may surprise you. Just a quick reminder, this video is for informational purposes. One sign that you may have been infected is if you have a cough that won't go away. The coughing mechanism is how your body gets rid of particles in the respiratory tract. During most lung infections, inflammation and mucus buildup occurs in the airways of the lungs, which makes it more difficult to breathe. Your body triggers a cough response in order to get rid of the foreign materials in your lungs, allowing you to take in more air and breathe more freely. Sometimes your cough is an obvious sign of an infection. For example, when serious infections such as pneumonia or bronchitis are present, you may have a cough that comes with very thick mucus that is green or yellow in appearance. Other times, it's not as obvious because the cough can be dry, meaning that no mucus or phlegm appears, and just know that your cough can linger for weeks or months after you've been infected. So this is definitely a sign to look out for if you suspect that you may have already had a lung infection. Another sign to look out for is, of course, a fever. A fever can occur for many reasons, but it's most commonly seen when the body is fighting an infection. The average body temperature is 98.6 degrees Fahrenheit, but it can fluctuate some, usually with warmer temperatures occurring later in the day. In general, some individuals will have a higher baseline temperature than others, but when a lung infection is present, it can increase as high as 105 degrees Fahrenheit. In general, although this is an extremely high body temperature, sometimes during a lung infection you can have a mild fever and not even realize it while still being able to carry on throughout your regular routine. The immune system helps adjust the BODUS thermostat in the hypothalamus to make your body feel hotter in order to combat the infection. And when a severe fever is present, you may experience chills even while sweating, with a high body temperature, weakness and fatigue, and sometimes even a headache. But with a mild fever that can occur with a lung infection, you may not even experience any of these symptoms. Another sign to look for, and we just mentioned it, is weakness and fatigue. Weakness and fatigue are two of the most common signs of a lung infection. That is because fighting off an infection takes energy from your body that you may have a difficult time manufacturing because the body is ill. Running a fever, battling with an infection, and a general feeling of unease can leave anyone feeling tired and a bit weak. The lack of oxygen in the body may also be a factor, because of course oxygen is required by all the tissues of the body to function properly. So if your body has decreased oxygen levels, it requires more work, which ultimately makes those feelings of weakness and fatigue worse. That leads us to the next sign that you may have a lung infection, which is shortness of breath. Shortness of breath is a symptom that occurs in most lung infections and can remain after other symptoms have gone away. This is likely due to inflammation that has occurred in the airways of the lungs. Shortness of breath can happen when performing activities that you can normally do pretty easily, such as walking to the mailbox or going up a flight of stairs. While doing these typical activities, if you notice that you are having trouble breathing, this could indicate that you've already experienced a lung infection. In such a case, it may be wise to seek professional medical advice and consultation. They will be able to perform more testing and prescribe you with the necessary medications if needed. They may also recommend certain exercises that can increase your lung capacity over time. Moving right along, another sign to look for is if you have suffered through a bad cold. because the symptoms of a cold virus are so similar to the flu virus. Some medical professionals initially have a difficult time distinguishing between the two. Regardless, both the flu and common cold can result in the occurrence of a lung infection. Bacterial infections may also occur after a viral infection because of the disruption of bacteria in the lung. Keep in mind that lung infections don't always cause a person to become bedridden. The symptoms can be so mild that you may not even feel the need to remain at home from work or your normal activities. These lung infections may feel like a cold, but they can still negatively affect the lungs and even leave lasting side effects. And one of the most bizarre signs that you may have experienced if you've had a lung infection is the loss of taste or smell. Now, it may come to you as a surprise, but a very large percentage of people who have tested positive for a lung infection will experience a loss of taste and/or smell. This is because certain viruses can affect the olfactory cells in the upper nasal cavity, which directly affects your ability to smell. Also, since congestion and drainage are usually present, they can block scents from reaching the portion of your nasal cavity that allows for smelling to occur. And it's important to know that these senses of smell and taste are very closely linked. This means that with the loss of smell, it can result in a loss of taste as well. So if you have experienced a loss of taste, it's most likely because you have lost your ability to smell. First, unfortunately, in some cases the damage can be permanent, or it can last for several months, but for most individuals the neurons will regenerate, and you'll be able to regain your senses of taste and smell once your body has fully recovered from the infection. So if you have experienced a loss of taste or smell recently and thought it was kind of weird, this may be a sign that you have been infected.